Miscarriage occurs in about 1% of all pregnancies. If a man is above 40, there is a higher chance of his wife having a miscarriage. The younger a woman is, the more fertile she is. And the younger she is, the better quality of egg she produces. The loss of a pregnancy at any stage is usually very, very devastating for the couple. So such couples need to be treated in an empathic and compassionate manner because it's a very serious issue to lose a pregnancy irrespective of the gestational age. Now, we term it miscarriage when there is loss of the fetus before the age of viability. The age of viability varies according to geographical location. So on the average, we take between 24 weeks and 28 weeks. So if a woman loses any pregnancy between from time of conception to between 24 weeks to 28 weeks, it is termed a miscarriage. Summarily put, miscarriage can occur in the first trimester, which is the first 3 months of the pregnancy, or in the second trimester, which is from the third month to about the 6 months, so that our women will understand it very well. Now, miscarriage occurs in about 1% of all pregnancies. For every couple who get pregnant, couple means the man and the female together, 1% will result in a miscarriage. Miscarriages do not just occur. Certain things make it happen. And these are what we call risk factors. The risk factors are classified under various headings. Now I will further break them down. You have epidemiological risk factors. The epidemiological risk factors refers to the age of this woman, her body build, if she's obese or if she's extremely slim, the age of her partner. Now, there's something very important about age and pregnancy. You will agree with me that the younger a woman is, the more fertile she is. And the younger she is, the better quality of egg she produces. That is why we always advise women to start having their babies at a very young age, not extreme of age, but at least an appreciable age, because during this time, you usually get the best. As a woman age, her eggs also age. And so you now start having very poor quality of egg. This poor quality egg often results in miscarriage. For instance, if the woman is about 20 years, the risk of having a miscarriage is less than 1%. But if she's 35 years to 39 years, she has a 25% risk of having a miscarriage. And if she's above 45 years of age, she has a 93% risk of having a miscarriage. So the higher the woman increases in age, the higher the risk for miscarriage. Again, if a man is above 40, there is a higher chance of his wife having a miscarriage. Because when we talk about miscarriage, there's what we call genetic predisposition. So the genes come from the male and from the female. If the male is given an abnormal gene, it results in an abnormal baby, and that abnormal baby will often result in a miscarriage. So higher paternal age, higher maternal age are both risk factors for miscarriages. Then again, any woman who smokes, primary smoker or secondary smoker, nicotine is toxic. It's embryotoxic and can affect the fetus and result in abnormality in the fetus, which will result in miscarriage. The same thing with alcohol and caffeine. That is why before a woman becomes pregnant, if she's used to these habits, we usually advise them to stop it or try as much as possible to reduce it to the barest minimum, especially during the first part of this pregnancy, because it is at that time that the baby is forming. This is what we call embryogenesis. So if you reduce toxins during this period, you have less problem and there'll be no miscarriage. Again, the weight of the woman. Women who are obese tend to be very, very big. They often have other problems that will also result in miscarriage. So this is for the epidemiological risk factors. Then we have a very important cause of miscarriage, which we call thrombophilia, antiphospholipid syndrome. Now, the sad part about this is, in many underdeveloped countries, screening for this thrombophilia is often very, very difficult because they do not have the necessary laboratory apparatus to carry this test. So you will find women having recurrent miscarriages without the doctors actually telling them what the exact cause is. Now, certain things in the woman will point to a thrombophilia. This include one, she gets pregnant. You have clinical factors and laboratory factors. When she gets pregnant, as at the time that the pregnancy is about 10 weeks, let's say approaching the third month, she has done ultrasound already, and the ultrasound will say the baby is okay. Suddenly, she does another scan and they tell her the baby is already dead. So the baby dies between 10 weeks of the pregnancy inside her womb. Or she has a history of thromboembolism, meaning accumulation of blood resulting in clots in either the limb or the hand. She'll start having pain, swelling. She'll go to the hospital. There's a history of thrombosis in the peripheral vessel. Or she gets pregnant, but has 3 consecutive losses at about 10 weeks. She just keeps having this type of miscarriages. Or finally, she's able to carry this baby beyond 6 months, 7 months, and suddenly her blood pressure increases very, very high, and she has to deliver that baby before 34 weeks because of placenta insufficiency. When these factors are present in a woman, they are pointers towards what we call antiphospholipid syndrome. I will talk about the investigation for antiphospholipid syndrome during our general investigation. So I just want you to note that antiphospholipid syndrome is a very important cause of miscarriage, and particularly recurrent miscarriages, which most of our doctors are not aware of and cannot diagnose in developing countries. Now, we also have a very important risk factor, which is the genetic risk factor.